Hi, good evening, everyone. Thank you for your time this afternoon and to joining us with this public forum. My name is Dr. Kevin Yip. I'm an orthopedic surgeon at the Gleneagles Medical Center. And so I'd like to start my presentation on the common orthopedic problems of knee pain and back pain. Now then, we are living in an interesting age in that we at present our population. If you look at the world population, it really has shot up tremendously. It took the human race 4 million years to reach the first 1 million population. Yet it only took the 15 years to reach for the world to increase its population to another billion in 15 years. So 4 million years for the first 1 billion, and it only took another 15 years in the last 15 years to increase the world population by 1 billion. And that, if you look at our average life expectancy, it has been almost quite constant right up until about 150 years ago. In other words, only about 150 years ago, the average life expectancy of humans has been about 40 years old. So in other words, a lot of the conditions that we see, like for instance, osteoporosis, cancer, heart problems, strokes, and all these problems, has never been a problem. Because the majority of the people die from other things, like being eaten by tigers and dinosaurs and things like that. So we have no time to worry about osteoporosis and cancer and things like that. So imagine that, you know, all along we have been living, our average life expectancy has been about 40. And it is only in the last 150 years that we have doubled our life expectancy. Doubled is a lot, you know. Double from the age of 40, now it's about 80, 85. For ladies, it's 85. They get extra bonus for giving birth to the children. Whereas men, 79 would be the sort of the average age. So the why has it been doubled? Well, because of many things. But I think principally it's because of the general increase in public health. That's one thing. We have better water, we have better living standard, and so on. And at the same time, there's also improvement in medical advances. In that we are better at treating many of the conditions. So, so it is important to know what are the latest advances in medicine, such that we will be able to know, you know, you will be able to know what are the things that can be done nowadays, what are the things cannot be done. Roughly that you at least know what kind of doctors will see these kind of problems and what are the treatments available for these treatments. Because very often in our practice, we often see patients who had these particular conditions for months and months. And then they come to see the doctor. And then, well, we can't solve all the medical problems so easily, but there are certainly many medical conditions where we can sort them out quite easily. And we'll be able to diagnose and treat these very easily. Then the patient will say, oh, should have come to see the doctor earlier. So sometimes it's important for the patient to know, roughly know, what kind of the problems, what kind of treatments are available for certain conditions. So this is why I think it's important for the public on the whole to know what, you know, to learn more about the medical conditions. You can learn these kind of things through the internet, through books, magazines, and so on. but certainly not the 10 minutes that you have with your doctors, because often you don't have much of opportunity to, the doctors don't have much of opportunity to go into great lengths about this. So I think attending public forums like these is quite useful, and we've been having these public forums for quite some time. And the next public forum, which will be in Mandarin, will be this coming Saturday. Here, same place. So for those who are interested, do give us a call to say that you're interested to come. But I think we've got quite a good number already. So, well, I think I'll start this by saying that so many people spend their time and health in their lives in gaining wealth, and then later having to spend their wealth in order to gain their health. So life is a cycle, and so is this. So a lot of the times, I'm sure a lot of you would agree that a lot of the times this is quite true, that when we're young, everything, wow, we're invincible, never get ill, and we can do all sorts of things, and we've got all the time in the world. And only when you get older that you realize, wow, pain here, pain there, and can't do this, can't do that, and so on. So, and that some facts, orthopedic problem ranks the second most common reason why people come to see doctors, and that the back pain and knee pain being the most common orthopedic problem. And the good news is that some of the treatments has improved quite substantially. So I'll start off with, now in orthopedics we talk about the spine and the limbs. Essentially these are the areas in which we concentrate on. So I'll start off from the top and then work downwards. So neck problem being a very common problem. Apart from the neck pain that many people may suffer, they also get numbness and pins and needles down the upper limb, this being the upper limb. And that's because often the nerve is being impinged at the cervical area, the neck area, and that's giving rise to the symptoms as if it is actually coming from the hand. And that back pain is also a very common problem as well. And in both situations, essentially the most likely cause is because of the disc or the bone spur impinging on the nerve there, resulting in mechanical impingement. And nowadays we can visualize this quite easily with the help of the MRI, and that this can see the impingement quite easily. And most of the times it is because of the problem of the actual disc in itself. And that when we look at the disc, what is the disc? Well, if you look at our spine is made up of a lot of these so-called vertebrae, segments of the bone known as the vertebra. And in between we have the intervertebral disc. And this is a shock-absorbing system which is pushing the force, and it is made up of a malleable substance, a squishy substance known as the nucleus pulposus, and is surrounded by a capsule known as the annulosus. And this helps to absorb the force. Now then, because of this capsule, with time, age, and increasing strength, you can give rise to cracks, and this results in the leakage of this nucleus pulposus jelly-like substance leaking out into the space. As you can see here, that the nerve is actually very close to the disc, and that it often causes impingement. Now then, this is a design problem. Design problem being that the nerve is very close to the disc. But the design was made quite a long time ago, a few million years ago. Difficult to change these designs nowadays. Okay, so we have to live with this. Now then, so patients often complain of back pain, and but at the same time they also get symptoms radiating down the back of their thigh known as sciatica. So the actual disc, if we look at it in an axial view, we see the cracks here, and then gradually the actual substance will then leak out and causes impingement to the nerve. And this initiates an acute inflammation, and that is why when the patient complains of pain, it's good to take anti-inflammatory medicine and rest in order to settle the acute inflammation. A longitudinal cut showing the same thing, in that this is the actual disc in itself with herniation and results in nerve irritation here. And with the MRI, one will be able to see the impingement. Now then, depending on which disc it is affected, the actual disc in itself, if it's, let's say for instance L4, L5, the actual disc will affect the nerve L5. So each nerve has a number to it. L means lumbar, number 5. So the patient will complain of the symptoms along the outer side of the leg, of the thigh, and that's known as the L5 dermatose. If the disc is L5, S1, then the S1 will be affected. Then the symptoms will travel along the back of the thigh, known as the S1 dermatose. So the body normally receives information from here going up to the brain. Now, if the nerve is being irritated here, then it appears as if the symptoms are actually coming from the leg, even though the leg have no symptoms. So when you press on it, there's no pain, but the patient perceives that the symptoms are actually from there, and this is known as referred pain. And here, this is the largest nerve in our body, the sciatic nerve. And hence the name sciatica. Sciatica traveling, where the nerve traveling down. But then the symptoms can either be pain, numbness, aches, or tingling feelings. So these are symptoms of just variations of the same thing. Now, how do we treat this? Well, I think during the acute phase, I think it's important for patients to take anti-inflammatory medicine, rest, maybe wear a corset, and physiotherapy. Failing these simple conservative method, then one of the things that one can do, which is quite effective, is an injection of medicine into the area, and that will alleviate the pain and by reducing the inflammation. So this is one treatment that is available, and that you can actually now then, that may help many of the people with this problem. Now then, only a small percentage of the people may require surgery, and surgery would involve in removing of this protruding part of the disc in itself. Here we see that this is the lump being removed. The operation is usually will take 2 hours to do, and the patient needs to stay in the hospital for about 2 to 3 days. It is not a particularly dangerous operation in the lumbar area because the spinal cord finishes in L1. So this is another video showing the process of giving the injection to the back of the leg. Now then, after the operation, the patient will be able to walk straight away and be able to go home after 2 to 3 days. Now then, in the recovery period, I think it's important, we often warn the patients not to lift heavy things, and if they have to, then one needs to adopt a good posture. Good posture involves in looking straight ahead in a horizontal position and not downwards. Because if we look downwards, then as you can see, the actual disc is compressed unevenly. We have compression at one side and tension at the other. So that would encourage the actual disc to herniate out more. And that when we're in a sitting position, it's also important to adopt a good posture, be 90 degrees. So we talk about the back problems. Now we move on to the upper limb, the shoulder problems now. Now then, there are a few causes for the shoulder pain. The first one is the shoulder impingement. Shoulder impingement is a common problem, and it's usually pain on lifting the shoulder above the head. And the cause of this is usually due to the impingements at the acromioclavicular joint here, which is a joint that's above the shoulder. Now then this can result in inflammation or partial tear or even a complete tear to the tendon known as the rotator cuff. Rotator cuff is a common problem resulting in shoulder pain. So here we see again acute inflammation to the rotator cuff or a partial tear to the tendon. And that once it's torn, then one may require surgical treatment, which involves in suturing of the actual tear in order to prevent the further extension. But luckily nowadays we can do these kind of operations through very small keyholes, and in fact the wound is actually quite small, and that one does this operate through a use of the TV camera, and with this we can see and repair the actual tendon. So here this video shows how the procedure is done. Small cuts through the skin, 2 portals, and here we insert a device, the arthroscope, into the joint, and once this is inside, then you can see the inside of the joints. Then we then clean up the tear in order to remove the scars, in order to allow healthy tissues to heal. Secondly, we then remove the impinging bone, which is often a spur here at the chromium. And after removing this, we then clean up the tear again and prepare the tissues for repair. And this involves in putting some so-called bone anchors, and this is done by drilling a few holes to the bone and then insert the anchors, and then these attach. So these are some surgical sutures which we used in order to close the tear. Another common cause of shoulder pain is so-called frozen shoulder. Now, the frozen shoulder affects the capsule. The capsule. Previously, we talked about the tendon. Now we're going to talk about the capsule. The capsule can be acutely inflamed. The patient often complains of initially pain, followed by stiffness. They have problems in moving the shoulder, and hence called frozen shoulder. And the reason why it is because the whole of the capsule becomes contracted, constricted, and this prevents the patient from moving. And it's a very painful condition. Whenever you move the shoulder, it becomes very painful. So this is another common cause of this problem. So we will move down the upper limb to the elbow now, and that this condition, known as lateral epicondylitis, is also a common condition where there is pain at the outer side of the elbow, especially with carrying heavy things and with turning of doorknobs and things like that, or opening a jar or something like that. And the reason is because of the combination of repetitive injury and degeneration to the tendon here at the outer part of the elbow. And how do we diagnose this? Well, it's quite easy. There is a very localized tenderness here, and there is pain on resisted extension of the wrist, and so this is a common problem. Now, then the treatment for this includes the use of a tennis elbow brace, anti-inflammatory medicine, and ice. Now, then, failing these, then there are some very good treatments for this kind of problem. These include the use of this machine, a shockwave machine, which delivers very high energy sound waves, and this sound waves would then break up the scar tissues and stimulates the body's healing process. So this is a very good treatment for this problem. And this is well-known face from Malaysia. And the tennis elbow is because of the problem of the extensor tendon here, inserted at this very point. There are problems with carrying heavy things, and there is a very localized tenderness to that particular spot. As for the hands, well, there are a few common symptoms that one may encounter. Numbness is one, lumps and bumps around the area, and there's problems with tendons. These are the common symptoms that patient may have in conditions associated with the hands. Now the numbness, why do patient complains of numbness to the hands? Well, the common cause is a condition called carpal tunnel syndrome. Carpal tunnel syndrome affects the outer 3.5 fingers, and it tends to be worse at night because we tend to swell up a little bit more at night, and because we lie in a horizontal position, and the nerve is being entrapped underneath this transverse carpal ligament, and this is the tight spots, and any swelling will result in numbness to the fingers, and it's usually the 3.5 fingers. And the treatment is involves in either injection or to make the tunnel to be bigger. Another area is pain to the root of the thumb, and this condition is known as Decavane's tenosynovitis. Very difficult to pronounce if you had a few cans of beers. And it is painful right at the root of the thumb, and it's painful to move your thumb, and carrying things is also quite difficult. So there you are, this is the root of the thumb, and the main problem is because the tendon has difficulty in sliding, and this is because the tendon is covered by a so-called tendon sheath, and this tendon sheath is inflamed, and this results in difficulty for the tendon to slide. The treatments involved in either injection or again enlargement of the tunnel, and this involves in a small local procedure, local operation that takes about 15-20 minutes to do. Lumps and bumps, most common cause is ganglion to the wrist, and these are quite common as well. Other causes of numbness are the ulnar nerve syndrome, and that is, in this situation, the patient complains of numbness to the little and half of the ring finger, and this is because another nerve is being irritated, and is usually at the elbow level. The nerve passes through a tunnel, which often is tight, and that results in numbness to the little and the ring finger. Trigger finger is a problem as a result of the, again, problem of the tendon sliding mechanism. In that the tendon cannot slide as a result of inflammation to the tendon sheath. And in this situation, the patient has problems in opening or closing the fingers. And again, how do we treat this? Usually by either injection or releasing the trigger finger here. So we move on now to the lower limb. Now we talked about the upper limbs now, some of the common conditions of the upper limb. Now we're going to talk about the lower limbs. Now for the lower limbs, the most common cause in Asia is the knee problem. Now in the case of the Caucasian population, the hip being a much more common problem. Osteoarthritis of the hip is by far more common than osteoarthritis of the knee. Now, why that is so, we don't really know, but it's a well-known fact, and some people suggest that maybe because the Asian squats a lot. but I'm not sure about that. I think we're all sitting down here. We're not squatting down on the floor at the moment. So I think nowadays people don't really squat that much nowadays. But we know that the knee problem is by far much more common than the hip problem. So we're going to talk about the knee now. Knee osteoarthritis is a common problem. We'll talk about how we can diagnose this condition and how we can treat this problem. Now then, if we look at the knee, we want to rule out any systemic or other generalized causes of knee pain before we talk about the local problem. Now then, the systemic problems can either, common cause would be gout. Gout means high uric acid. High uric acid can cause multiple joint problems. Even though the most common presentation is the big toe, often very painful, but it can present with knee pain or ankle pain. Sometimes the left, sometimes the right. Why the left, why the right? No idea. So the body is like that. So why, you can explain certain conditions, but sometimes, why the left knee? I walk with both knees. Why do I have pain to one side but not the other? We don't know. Pardon? Oh, that's right. That's right. Yes, that's right. So it's actually, we cannot explain why, but many conditions tend to present with one side more than the other. So gouty arthritis is a common cause of this problem. As you can see inside the knee joint, you see almost like a snowstorm, a lot of these gouty tophites inside, and it results in acute inflammation to the joint, and so we need to rule that out sometimes if the patient presents with this problem. So they present with acute inflammation. So let's look at the anatomy of the knee now. What is the knee? The knee is the junction between the thigh bone and the leg bone with a kneecap in the middle. At the ends of the bones is covered by this cartilage. This cartilage prevents the bones from rubbing against one another, and with with time, the cartilage can get damaged, and this is what happens. And then once it's damaged, then you get bone spurs growing at the edge of the joints. And then at the same time, you also get loose bodies or bits of the bones and cartilage being sort of floating away into the joint. So this is what one will get. And you can get two types of deformity, either knee pointing out or knee pointing in. So these are the deformities. Treatment includes medication, weight loss, lifestyle, and then cleaning up arthroscopically, which means keyhole surgery, or even a joint replacement. So when we look at the knee joints, here we see the cartilage, the most important structure here in the knee. And here you see it's very thin, only a few millimeters only. And these few millimeters of cartilage is not particularly hard structure also. It's not like the bone, it's not very hard. And yet it's very important because this cartilage prevents the bones from rubbing against each other. And this cartilage in many situations can last for 60 years, 70 years. That's a long time. Imagine that if you compare this with let's say our shoes, how long do our shoes last? Maybe a year, 2 years. For girls, maybe 1 week, 2 weeks. These are can last 60, 70 years. That's a long time. And the reason why it can last so long is because it's a living tissue. A living tissue being that it will continue to grow and will grow with stimulation. So how do we stimulate it? Exercise, walking. So that's how the cartilage can last so long, because it's not a tough structure. It's actually, it will grow. Every day it will grow. So this structure can last for a long time. So how does the osteoarthritis, how does the actual condition present itself? Well, if we plot function of the knee against the age, then we'll see that when we're very young, function 100%. Then as we get older, then when you get an attack of this knee pain, then it gets better. And then after that, then you get another attack. Then it recovers again. So it goes up and down, very much like the Hang Seng Index or the Strickland Index. But important to look at the trend, just like the stock market. Look at the trend, where it's going, which direction it's going. So as we get older, definitely our function will going to get not as good as when we were young. So here you see these are the 4 stages of this condition. Here we see that the cartilage nice and clean, and as we get older, you start to develop fissuring of the cartilage. At the 3rd stage, we developed osteophytes or bone spur with loose bodies, cartilage instead of the joint, and that the bone here becomes a little bit thicker as a result of as a reaction to the excessive force, and that and the osteophytes or bone spurs become worse. So this is what it would look like normally, and then this is the mid stage, and this is the last stage where you can see the bones being exposed. And that so here this is a normal knee would look like, and this is what a knee with worn out cartilage looks like. You can see that the cartilage doesn't look very smooth, it doesn't look very healthy, and you can see the bone being exposed, and this is what it looks like. So the this side, this is like the putting green, and this is like the pitching green. So these are the different stages of this condition. So how do we treat this? There are well, the most well-known nutritional supplement is the glucosamine and chondroitin, and these have shown to be help with the cartilage, the healthiness of the cartilage, and it does help to reduce the pain, and it will make the knee to last longer. Now then, what happens when a patient develops an acute attack of knee pain? Well, sometimes you may get a lot of swelling, and sometimes you may need to aspirate the fluid. Taking anti-inflammatory medicine, resting, and ice will certainly would help. And that's another treatment for this condition, if it becomes a problem that will not settle, is an injection of a lubricant into the knee joint. This is an office procedure, and it can be done quite easily. It's not painful. If it's painful, then someone is not doing it quite right. It's not really painful. It's more or less like having your blood taken. It is not painful. The substance is injected into the joints after removing the excessive inflamed tissues, and then this substance will then diffuses into the joint cavity and will reduce the acute inflammation and help the knee to last longer. So this is how we would do it. We clean this. This is, you see, the arthritic joints. This is the kneecap. Remove, and that, you can see that the joint is normally covered with this synovial fluid. This fluid will, you get acute inflammation, then you have more of this fluid. First of all, we clean the skin, and the needle is inserted after putting some local anesthetic, and then we then inject the lubricant into the joint, and this will diffuses to the different compartments within the joint, and then the patient is able to walk straight away after that without any restriction. The next is arthroscopic washout. This will be useful for those with intermediate problems, and it's a procedure where we use a very small portal, very small, in front of the knee, and with this we can then see the inside of the knee. Now then, this is both a diagnostic and a therapeutic procedure. Diagnostic in that we can see the inside, document the inside, and look inside and take some pictures. You know how bad it is. How do we treat this? We remove the loose bodies and then remove the fluid, and it stimulates the areas where there is a deficiency of the cartilage. And so these are some of the loose bodies that the one can remove, and sometimes you can see these loose bodies inside the knee joint. So you see, this is one place you can hide your pearls, you see. So inside the knee, nice and round. And that with the cartilage, if it's defective, one makes small channels in order for the blood to go through and heal the area. So with blood going to the area, then it tends to stimulate the healing process. Then another good procedure for the treatment of osteoarthritis is total knee replacement. Total knee replacement is a very good operation. At present, about 400,000 cases are done per year, and it's effective, and therefore so many people are having it done. And that this procedure involves in resurfacing the joint by putting the combination of metal and plastic inside the joint. And we've been using this for the last 30, 40 years now, with a lot of experience, a lot of improvements in this, and it certainly works very well. This is what it looks like on the X-ray, and it takes about 2 hours to perform, and the patient can walk more or less straight away after the operation. It is not painful nowadays to have this procedure done, because we use an injection at the back, and that will numb the leg for a good few days. And it's so it's not painful. The patient can wait there on it straight away, and they're required to stay in the hospital for about 3 days. And it's yes, in the past that the patient are not able to squat as well, but nowadays we've improved the implants much more, such that the patient are able to squat quite well, and it can last for a long time. 25, 30 years is a long time. So it's like a crowning, for tooth decay. It's a very good procedure. So in medicine, there are some conditions that we can treat well. There are many conditions that we cannot treat well. Like, for instance, stroke we cannot treat well. Cancer we cannot treat well. Certain conditions we can treat, but you have to maintain that medicine for a long time. Diabetes, high blood pressure, and all these things. But there are some very good surgical procedures which we can do and will help the patient an awful lot. Take, for instance, well, I mentioned about filling, dental filling, crowning. Very good procedure. And that, so nowadays, these are good procedures. Cataract is another operation. Cataract, usually patients put up with the blurring of the vision for a long time. And then they have this operation done, cataract, and then suddenly they can see so well, wow. And then they wonder, how come they didn't have this done earlier, So often they are like that, and then often one disadvantage is that after you have it done, you then look at your wife and they say, wow, how come you suddenly look so old? So so it's a very good operation to do. Talk about the foot now. Moving on to the foot now. Heel pain is a very common problem, and it is because it's usually painful after when you get up first thing in the morning. It's painful for 15 minutes, 20 minutes, or after prolonged walking. So this is a common problem, and this is because of the plantar fascia at the bottom of our foot being attached to here. And it is very near to a nerve, and this is a result of degeneration and injury to the plantar fascia. And that the treatments usually is a combination of either injection or use of what I mentioned, the shockwave therapy. And the shockwave therapy is certainly good for stimulating soft tissue healing. Ingrown toenails is also kind of things that we often see as well. And that bunion. So girls like to wear nice pointy shoes, trying to convert their foot into the shape of their shoes by forcing it through to make it look pointed, and this results in so-called bunion, and that this is a painful condition, and it also not look so nice as well. So this is a common problem that we also see as well. So this is the bunion, and we need to correct the toe and remove the bunion. So, okay, so we talked about the upper limb and the lower limb. Now we're going to touch on the some of the disorders that affects the whole body. And one thing is certainly is everybody heard about is called osteoporosis. Now, osteoporosis is a condition where there is thinning of the bone. Thinning of the bone. This is there is low bone mass, and it becomes very thin. And that it is a very common condition where there is bone thinning of the bone compared to normal bone with the osteoporotic bone. And that the treatment, or before the treatment, it's important to diagnose the condition. And to diagnose the conditions, there is a screening test, and that's using ultrasound. And ultrasound will be able to gauge roughly whether your bone is osteoporotic or not. And that I think Jace earlier on mentioned about this test being available at our clinic. So if you want to have this done, it's free of charge. You just go there and have it tested tomorrow at our clinic. It doesn't take long to do at all. And so once this is done, depending on what the readings are, one, if it's low, then one may require to have a more formal gold standard scan known as the BMD, bone mineral density scan, and that this will give you a much more accurate assessment of your bone status. And that treatment involves in exercise, prescribing a good exercise program, and to ensure that one is taking adequate calcium. But exercise and calcium may not be enough, and sometimes may require other medicine as well in order to assist the bone to absorb more calcium. So other sort of latest treatments are the PRP, plasma-rich platelets, and that this is a lot of buzz has been going around because it seems to be quite effective. If you go to Google, you can see almost a million references, and that this treatment is good for a lot of soft tissue injuries. Soft tissue injuries in that tennis elbow, heel pain, Achilles tendon problems, and so on. So it's good for soft tissue injuries. It involves in the use of the body's platelets and chemicals, which is in the blood. We extract the blood from the patients, and then we purify and then add chemicals, and then extract the useful chemicals, and it is then injected into the affected area. So there are kits that's available. We then process this and then inject it back into the patient, and that will promote the healing process. And it certainly helped in reducing the pain for many conditions. Epidural, I mentioned, is a good method for treating back problems, and that again is done as an office procedure or a day procedure, and it is quite effective for patients with back problems. shockwave, I think we mentioned about the use of using high energy sound waves for treating many conditions. And so another quote, time and health are the two precious assets that we do not recognize and appreciate until they've been depleted. So I think many may agree with that. So the tips for good health: to ensure good health, eat lightly, even though there's plenty around. Breathe deeply. Live moderately. I don't know what that means, live moderately. Cultivate cheerfulness. And maintain an interest in life. So live an interesting life, and that be involved, continue to work, and that involved with the family and in sports and so on. So exercise very very important, because nowadays 10 years ago people always been talking about not enough food on this planet. And now what do we see in the Western world? Wow, people getting bigger and bigger and bigger. Not enough food around. Wow, you go to buffet in restaurants and hotels. Wow, so much food around. So, but of course, it's the distribution, isn't it? Certainly, some countries may not have as much as other countries, but in the Western world, certainly food now becomes a problem because we have so much of it. Because we're able to produce food at a much more efficient way. And so exercise is very important. I found this, recently. This is a guy who is in the 70s, and that he has altogether done 1,800 marathons. Now, just to explain, a marathon is run 42 kilometers, and that's, I don't know, I think it's from here to Changi and back, and there and back, I think. And that he's done almost 2,000 of this, and that's on average about 38 marathons a year. So he has to travel around to different countries. Nowadays, every city will have one, once a year or many times a year. So he has to travel around in order to get enough marathon. And in Singapore, this is from Singapore Records. This gentleman, Richard Hu, who is 81, and he's done 40 marathon. So this is also very, very and so I think 40 marathon, not bad. And yesterday, a patient came to see me, yesterday, around about this time yesterday, and this is the gentleman I saw yesterday, and he is, I took some X-ray of this gentleman. Can we guess which one is his knee? This one? Anybody? This one?
Yeah.
Yeah?
Yeah.
No, actually it's this one. So, this gentleman is 79, and he just finished a marathon about a week and a half ago. And he'd been started a marathon at the age of 55, gave up smoking as well. And since then he's been running about 5 marathons a year. Is he here, can I ask? Pardon? Is he here? Where? Hi! I didn't see you there. We have lots of questions to ask you later on. So this is Mr. Chan there. Okay, so this is so you can compare the knee now. This is his knee. So okay, these are some of the pictures that these are members of our family who's involved in some sports. This is my sister. She looks in pain running this time. Not easy. This is my brother-in-law doing the triathlon. Triathlon is also quite tough as well. Involves in swimming and cycling. This is my nephew. And this is also my nephew doing a 19 kilometers walk in the blind for charity for I think for some society for the blind. And it's we had to go marathon. My wife. This is a few weeks ago, and this is 1979. No, 96. And also been in the paper before for other things, including taking my children out of the normal Singapore schools because I was worrying about them not able to keep up with the well-educated Singaporean children, and so we did. They did O levels earlier, age of 12, and finished the O levels at the age of 14 and 16. So they were. This is my youngest. And so our clinic is situated here at the Gleneagles, the first clinic here after the main door, and it's, you can contact us anytime. This is the clinic. We're on the ground floor. Okay, thank you, and wishing everyone a good night.